So like Sal said, my name is Tia. I'm the lead APP for the Madison Metro office. When I came to Pivotal, I had a lot of the same questions Sal just asked you. So when most people ask me, that was a nice noise, how I ended up here or how I like my job, my answer has always remained the same over the last 2 years. I always say I never imagined doing this type of work or working in the setting that I do now. I usually pictured myself in a rural setting, having a patient panel of 500 plus people, knowing everybody in town, taking some form of work home with me, whether that be charting or just making sure that I'm following up on all the tasks that I completed that day. However, while I never anticipated working in this type of setting, which I do now, I absolutely love it. I've seen many things over the last 2 years at Pivotal that a traditional provider that works in a typical practice setting may not see. I anticipate I will see many more in the years to come, and I truly do look forward to it. I'd like to start with some of the most memorable experiences that have proven to me that working in this setting truly is where I'm meant to be and that this is how healthcare should be delivered. However, it is much easier to start with what I haven't seen at my time at Pivotal. In the last 2 years, I haven't seen a patient already frustrated with me when I'm walking into the room because they've been waiting in the lobby for 2+ hours to be seen for their hand injury, those 2 hours that they won't get back from missing work that day. I haven't seen a mother anxiously corralling her 2 older children as she's waiting for her younger child to be checked for an ear infection. I haven't seen a burnt out healthcare team just waiting for 5 o'clock to punch out when the day is over. And finally, I have not seen a patient that is uncomfortable or unsteady about inviting me into their home. I have fortunately, in fact, seen the exact opposite of these situations. So I can tell you last week I was preparing to see a smaller children, actually 2 children in one of the more rural areas that we service. While getting ready for my visit, walking to the front door and simultaneously checking my patient in on my iPad as I typically do. Out of my peripheral, I saw a mother motioning me towards the front door in a rather fast fashion. So naturally, I kind of sped up towards the porch. Little did I know, we had her rooster running from the side of the house, full speed ahead at me. Let me tell you, I have never ran so fast into a house call before. So while this was a rather chaotic start to our visit, it truly ended up making it so unique. I was able to joke with her 2 children about how their rooster chased me into the house, whom I later learned was named Rocky. They were too busy laughing and focusing on the fact that I got chased by Rocky to worry or focus on the often fearful notion that they're going to see a healthcare provider. And let me tell you, those were 2 of the easiest strep tests that I have ever done, and I truly can attribute that to their trust in me as a person in their own space before their trust in me as a healthcare provider. I've come to greatly appreciate seeing kids in their own home during these house calls. I'm sure many of you have children that you've had poor experiences with in a traditional urgent care setting. A couple weeks ago, I sutured up a chin from a trampoline injury while the child was concurrently watching Bluey. I've been able to check children's stuffed animals' ears to tell them that they have an ear infection, which makes it much less frightening when I also tell them that they have an ear infection. I've looked at skin rashes under blanket forts that have been built just prior to my arrival, completed COVID and flu tests in park benches. Seeing adolescents, teenagers, and adults has also proven to be equally enjoyable in this line of work. I can now proudly say that I have been in every single sorority and fraternity in the greater Madison area. I'm not sure how many of you are familiar with how a typical fraternity looks on a Friday night or Saturday morning, but for those of you that are, once you have successfully completed a visit where you haven't had to pick your shoes up off of a sticky floor, move 15 solo cups for some table space, I usually tell my providers you can complete any visit after that. So now that you have some good experiences, a little bit more about our house call. So like Sal said, our patients book our house call at the time that they want via our app or by calling us. We have about an hour with the patient. That does include drive time, but most of my visits last anywhere from 20 to 30 minutes, give or take, especially if I'm seeing a couple kids. That allows our providers to have much more time with the patient than they would in a traditional setting because I am the nurse and I am the provider in that visit. It's not in and out like he was mentioning before. So each visit is conducted by an experienced nurse practitioner, or we have physician assistants also who can assess, diagnose, treat, and prescribe for a wide variety of mental and physical health conditions. Our providers are able to order and complete point-of-care testing right at the visit, which includes COVID, flu, strep, mono, treating or diagnosing urinary tract infections. RSV is really common, or a combination of both oftentimes. Each provider comes prepared with an iPad that lets them allow us to document data collected at the visits and send prescriptions electronically prior to the visit being completed. So within another half an hour, your prescription is usually ready and to go be picked up at the pharmacy if necessary. We also always have a backpack and a vehicle stocked with all of the necessary supplies that we should need. If your child has strep and now your other one all of a sudden has a laceration, we're always prepared for adding on another visit. So common urgent care complaints that we typically see, or that you guys might be familiar with, are coughs and colds, upper respiratory tract infections, urinary tract infections, sexually transmitted infections, ear infections is really common in kids, skin infections like I was saying, so rashes, poison ivy, shingles we see frequently, and then we're also able to see orthopedic injuries, so any sprains, strains, or fractures. We're contracted with a national x-ray company, so we're able to order x-rays. They come right to your home or workplace. Oftentimes the provider will meet you right there to do the wet read, and then we're able to cast as necessary for temporary casting, eye injuries, work-related injuries, and many, many more. In addition to urgent care, we also offer primary and mental health care, as you guys may have seen on our banner. So we have a large and growing panel of primary care patients, ranging from relatively healthy adolescents to older and complex elderly patients. We can coordinate and refer to specialists as needed, order necessary preventative treatments like Cologuard, screening mammograms, stuff like that. In this population, I truly have come to enjoy seeing primary care patients in their own home. Last week, I actually had a routine visit with one of my primary care patients who was simultaneously breastfeeding while I was reviewing her health history and then drawing her annual labs. So that may not otherwise happen in a busy clinic where you had to leave your kids at home just to get to the doctor. Another visit the other week, I had a mom who was folding laundry as she was concurrently helping me with her daughter's health history, so that made everybody happy. So the additional time and just comfort of somebody's home truly does make these visits remarkable. For our mental health, our clinicians have expert training in treating and diagnosing common mental health conditions such as anxiety, depression, and ADHD. Our visits for mental health oftentimes include placing referrals to in-network therapists for additional counseling resources during our one-on-one time with the patient. And then lastly, we also do a lot of occupational health. So like I was saying earlier, we're able to see common musculoskeletal or orthopedic injuries. We also now do health risk assessments for larger corporations. Just coming right to your visit to do biometric screening, checking lipids, blood pressure, just kind of your heart risk scores. And again, oftentimes we go right to patients' job sites to do those. It's I believe truly one of the best ways to optimize healthcare. This spring I was able to suture up a wound with Dr. Culp over there in the garage of a newly built home. And then last summer I actually had the privilege to help remove a rather large nail from a man's hand during a work injury on a balmy 90-degree day. I was shocked when the worker immediately asked me if he could return to work, proceeded to pick up his tool belt after I was done bandaging him up, and he did just that. So again, no time spent driving to urgent care, waiting in urgent care. He was able to go right back to work with his boss's consent, obviously, after we were done fixing up his hand. So the opportunities with Pivotal Health truly are endless. I'm privileged to continue to watch us grow, and we are really excited to be here and bring healthcare towards you guys.